good evening or afternoon, everyone. Welcome to this press conference following the EPSCO Council. Today's focus was on health. Let me welcome Polish Minister of Health, Izabela Leszczyna, and Commissioner for Health and Animal Welfare, Olivér Várhelyi. Without further ado, I give the floor to Madam Minister. Pani Minister.
Dzień dobry Państwu. Bardzo dziękuję tym, którzy mieli tyle cierpliwości, żeby wytrwać z nami cały dzień. Myślę, że możemy powiedzieć, mamy to. 6 miesięcy polskiej prezydencji kończy się właściwie formalnie dopiero za kilka dni, ale dla nas, dla tych wszystkich, którzy zajmują się zdrowiem, dla Rady EPSCO, dzisiaj to było takie formalne zakończenie polskiej prezydencji. No i zrealizowaliśmy w tym czasie, polska prezydencja, ale także wszystkie kraje członkowskie, cele, które sobie założyliśmy. Przede wszystkim priorytety polskiej prezydencji, a więc bezpieczeństwo lekowe, zdrowie psychiczne dzieci i młodzieży w erze cyfrowej, profilaktyka chorób, profilaktyka w zdrowiu publicznym i cyberbezpieczeństwo w systemie ochrony zdrowia. To były nasze priorytety i tak, można powiedzieć, że mamy sukces. Sukcesem jest z pewnością to, że Rada Unii Europejskiej dała polskiej prezydencji mandat i mogliśmy rozpocząć trilogii, czyli negocjacje największej od 20 lat rewizji prawa farmaceutycznego. Mówię o pakcie farmaceutycznym, nad którym pracujemy w Unii Europejskiej od 2 lat. Rozpoczęły to poprzednie prezydencje. Nam, polskiej prezydencji, udało się wynegocjować kompromis i za ten kompromis wszystkim państwom członkowskim z całego serca dziękuję, ponieważ pakiet farmaceutyczny to bezpieczeństwo lekowe. Pakiet farmaceutyczny to dla wszystkich Europejek, dla wszystkich Europejczyków lepszy dostęp do potrzebnych leków. Pakiet farmaceutyczny to z jednej strony dbałość o to, żeby firmy innowacyjne, przemysł farmaceutyczny w Europie się rozwijał, a żeby Europa była konkurencyjna, a z drugiej strony pakiet farmaceutyczny to coś, na czym zależało nam od samego początku i na co właściwie umówiliśmy się z krajami członkowskimi. Umówiliśmy się na to, że w centrum naszej pracy, w centrum naszej troski zawsze będzie pacjent. Czyli z jednej strony firmy innowacyjne mogą w bezpiecznym otoczeniu prawnym prowadzić swoje badania, wprowadzać innowacyjne produkty na rynek, a z drugiej strony dzięki przepisom w tym zrewidowanym prawie farmaceutycznym, dzięki paktowi farmaceutycznemu dajemy szansę lekom generycznym, czyli zamiennikom tańszym, bo dostępność do leków to dostępność z jednej strony terytorialna, ale z drugiej także ekonomiczna. I z tego pakietu bardzo się cieszymy. Ale cieszymy się także z tego, że przyjęte zostały dzisiaj podczas Rady konkluzje dotyczące właśnie zdrowia psychicznego dzieci i młodzieży. Nad tymi konkluzjami pracowaliśmy wspólnie z wszystkimi krajami członkowskimi, ale pracowaliśmy nad nimi także z młodzieżą, z tymi wszystkimi, o których zdrowie psychiczne się właśnie troszczymy. I te konkluzje zostały przyjęte z dużym zadowoleniem, bo wszyscy wiemy, że zdrowie psychiczne dzieci i młodzieży w erze cyfrowej jest dużym wyzwaniem, dużym problemem we wszystkich krajach unijnych i że działania nie tylko na poziomie regionalnym czy krajowym, ale także na poziomie unijnym są po prostu konieczne i niezbędne. Konkluzje dzisiejszej Rady to także to, że profilaktyka to inwestycja, a nie koszt i że najwyższy czas jednak otworzyć dyskusję nad dyrektywą tytoniową, bo świat nie stoi w miejscu i dyrektywa sprzed już prawie kilkunastu lat, na pewno ponad 10, nie obejmuje tych wszystkich niebezpiecznych, szczególnie dla młodych ludzi, produktów, które są na rynku. Cyberbezpieczeństwo to ostatni problem, którym zajmowaliśmy się w związku z prezydencją, choć agenda dzisiejsza była oczywiście jeszcze bogatsza. I jeśli chodzi o cyberbezpieczeństwo, wylistowaliśmy sobie cały szereg problemów, które musimy podjąć, musimy zacząć rozwiązywać. Tu najwięcej zdań padało w związku z tym, że nasi świadczeniodawcy nie są przygotowani do stawania w szranki z cyberprzestępcami, że cyberzagrożenia są na tyle duże, że to państwa unijne i cała Unia Europejska muszą zaangażować się w ochronę danych pacjenta, w ochronę bezpieczeństwa tych danych i tego wszystkiego, co nazywamy internetem rzeczy, a co właśnie w systemie ochrony zdrowia jest coraz częstsze, jest bardzo potrzebne, wspiera leczenie i terapię naszych pacjentów, ale niesie ze sobą zagrożenia. To chyba tyle w dużym skrócie i na razie bardzo dziękuję.
Commissioner, the floor is yours.
Thank you very much. First of all, it's an honor to be next to Minister Leszczyna, who has run a very successful presidency. And I think I speak on behalf of all of us, thanking her in the achievements that her presidency has put on the table. Today we have touched on a number of topics. I think the Minister has already explained a number of those. We had basically reflected all the priorities that we have also set ourselves as priorities for the Commission during this mandate. First of all, we had a discussion on the Critical Medicines Act, which is not only essential for public health, but for the overall security of supply of medicine in the European Union. And we have seen already during the COVID crisis how medicine shortages can seriously compromise patient care, the public confidence at large, and also the resilience of our healthcare system. This is why, as promised, I have put forward this proposal very early on in the mandate, already within the first 100 days in the office. And this act should help us to address the structural market failures and the external dependencies and supply chain vulnerabilities that we have all seen. It is very clear from the debate that it provides a new toolbox, including the strategic projects and procurement tools to support and encourage EU manufacturing coming back to Europe of vital medicines, but also of active ingredients. For critical medicines where dependencies on third countries are too high, the Act will ensure that we favour EU production while complying with our international commitments. The Critical Medicines Act complements, of course, the very ambitious pharmaceutical reform, which is currently on the table. And I'm very pleased that the Council has managed to come to an agreement. And not only that, but we have already had the first trialogue this Tuesday. And I was urging both the Council and the Presidency, the next one, to be as successful as the current Presidency and to come to a swift and meaningful agreement still this year on the pharmaceutical reform, together with the Critical Medicines Act. Because now is the time when we must take a proactive and united stance in ensuring the availability and the security of supply of medicines. We must address this growing challenge of critical medicine shortages. And we must ensure that on the global stage, our pharmaceutical sector is strong, resilient, and competitive still. It is also very important to see that the member states have been united around these goals today. And what we need now is accelerated work to get an agreement on these files, both still this year. Another priority was the preventive health, where we also had a number of exchanges today. On non-communicable diseases, we see that this is a significant burden on our health system, but also on our society. It accounts for up to 8% of total healthcare expenditure in 2022. Cardiovascular diseases alone cost European health systems close to 280 billion euros annually. But it is also clear from the discussion that almost or up to 70% of this burden could be prevented. So at the time when our healthcare systems are under increasing strain, prevention could be the most effective way of cutting costs and relieving burdens. And with this in mind, we intend to present an ambitious cardiovascular health plan, as it was also announced during my hearings, to improve the prevention, the detection, management of cardiovascular diseases. That should include, of course, actions targeted towards obesity and diabetes across Europe, and which will harness also the power of digital tools to achieve this. We will, of course, have to support member states in addressing the common risk factors such as tobacco, nicotine consumption, both traditional and novel products. We have had 2 exchanges on this today. The Europe Beating Cancer Plan aims to create a tobacco-free generation by 2040 and reduce tobacco consumption to below 5% of the population. And this goal has been only reconfirmed also in today's discussions. We are currently evaluating our own rules and with a view to revising them still this mandate. And of course, it's a common interest to achieve all these goals that we have already set out. If we want a healthy society and a competitive one, we need to make prevention a priority. And I think that we have all agreed on this. And that leads me to the next interesting point of discussion today about mental health of young people. You have seen this topic coming to the fore in the last 6 months or so. And today we have also adopted Council conclusions on that, which shows a firm commitment to promote and protect the mental health of our youth in the face of many challenges they have to face in the digital age. As you know, the Commission has also put the mental health of young people high on the agenda for the coming years. We carry out now an EU-wide inquiry on the broader impact of social media and mental health and well-being, while continuing with our 1.3 billion euros comprehensive approach to mental health. We are already supporting very specific actions to protect children in the digital age, as well as working with key partners such as UNICEF on this very topic. We are also working to tackle health disinformation online. This is, again, another topic we discussed. And we also see very clearly these days that this poses a real threat to every generation of our societies. We want to, of course, create the opportunity for citizens to make informed choices and decisions on their health, but they can only do this if the information they receive is trustworthy, evidence-based, and valid. So, with this, again, I want to thank the Polish presidency for the immense hard work and the major achievement of getting the pharma review agreed in the Council, which was, I think, a very heavy task for the presidency, but they have managed. So with this remarkable achievement, I hope the Danish presidency will be able to deliver even more. Thank you.
Thank you so much. Do we have questions? I see Agnes.
Hello, Agnes for Context. I have a question for Commissioner Várhelyi on the tobacco legislation. Can you be more specific about the timing of the publication of the revision? Because you said during the mandate, but can we have a more precise calendar? And will you also act before then via delegated act, as the Belgian health minister suggested during the AOB point? Thank you.
Well, the timing of the revision is not yet set. We are at the phase of preparing it. We are having public consultations, and after that we would want to come up with a robust and solid impact assessment. You know the stakeholders in this debate, so we better make it bulletproof, and this is why we devote maximum effort and time to have something really solid and something that cannot be challenged. When it comes to the different national measures, I think this is what you have referred to, that member states are taking. Of course, we're looking at that, and as you know, the Commission has already banned flavors in 2023 for electronic cigarettes. Now, today we have seen not only those who have already taken measures, but we have new member states considering taking measures, and I think that we are getting to a point where this is creating a critical mass, and we are looking at that. With an open eye and with an open mind. So we will see where does it take us. But the Belgian minister was right. The Commission has powers which it could use.
Thank you. Marie?
Hi, Mary Eccles from Politico. I've got two questions for the Commissioner. So the first is on the Critical Medicines Act, and you've been really clear that you want an agreement, I think, by the end of the year. Given what you heard today from ministers, how feasible do you think that is, and what do you see as being like the potential sticking points in the negotiations? And secondly, I think it was the Spanish minister in the discussion on prevention who talked about the lack of funding that DG Santé is providing to NGOs, or health NGOs anyway, in Brussels this year, and that's led to a lot of public health NGOs losing staff and cutting projects. Given the importance that you've placed on prevention in your mandate, I wonder, do you think that health NGOs receive adequate funding from the Commission, or would you support more cash being given from the Commission this year? Thanks.
Well, on the Critical Medicines Act, what I have heard today was very encouraging, because it seems that there's broad agreement on the challenges. There's also broad agreement that the proposal is fit for purpose. I think if there is one conclusion to be drawn from the discussion today, is that. Now, of course, there would be elements what would need to be looked at close. But I think on the broad lines, there is no major disagreement. This is why I feel encouraged, and this is why I'm pushing for a quick adoption. Don't forget that this is a topic which is long overdue. We're talking about a problem that we have not addressed for the last 5 years, while we know it needs addressing immediately. So I think that this sense of urgency was shared by everyone. On the lack of funding for the health NGOs, you know, this is the first year when the Commission has to implement the EU for Health as it was amended by the MFF midterm review. In the MFF midterm review, the already very modest budget of the EU for Health, which is 5.6 billion euros for 7 years, has lost 1/5 of it, 1 billion euro. So we have to redesign everything, and we have to really cut it back to the core business that we're doing. And this is why it takes longer for us to design our budget, and in that it means that we have to decide about the cuts. And I don't want to cut public health actions. I don't want to cut core business. But to be frank with you, somewhere a line has to be drawn. And maybe NGOs can also look for other sources of funding. But for sure, I'm experiencing a very heavy budget constraint. Thank you.
Okay. Claudia, yeah? And I think that's all the time we have for questions. So,
hi, Claudia Chiappa, also with Politico, and also a question for Commissioner Várhelyi. You mentioned obviously the EU inquiry into the impact of social media and to the well-being of young kids. I was wondering if you can give us an idea of where the Commission is with that, and if there is a timeline for when it will be concluded. Thank you.
We try to speed up that work, and we hope to come with proposals, I think, still this year. This is the idea. We cannot wait any longer. The impact is there. It is very clear what are the main topics. But you know, if you run a consultation, you better wait until you get the responses before you draw your conclusions. But I think we're quite advanced in the work, and I hope to come with proposals still this year.
thank you so much. I think that's all the questions for today. And perhaps one final word, which is a Polish word that we're teaching at the press conferences here. I think zdrowie, simple, it means health. Thank you so much, and have a good afternoon.